Have you ever felt your heart racing or skipping a beat? Today, we're diving into the world of heart palpitations, a sensation that can leave you feeling as though your heart is throbbing, pounding, or fluttering right in your chest. These palpitations are not figments of your imagination, but are often the result of your heart's rhythm changing pace. Sometimes your heart might decide to sprint, beating faster than its usual rhythm, a condition known as tachycardia. Other times it might choose to take a leisurely stroll, beating slower than normal, which is called bradycardia. And then there are moments when it might decide to freestyle, skipping beats or beating irregularly. Several factors can trigger these palpitations, from lifestyle choices to underlying health conditions. But no matter the cause, there's one thing we all share when this happens: a sense of concern. Fear not, for this is a journey we'll embark on together. Coming up, we'll discuss what to do when experiencing heart palpitations. Scene script. First, let's understand what heart palpitations are. Imagine your heart as a well-oiled machine working tirelessly to pump blood all around your body. Sometimes this machine encounters a few hiccups, causing it to beat too fast, too slow, or irregularly. These hiccups are what we call heart palpitations. It might feel like your heart is throbbing, pounding, or fluttering, almost like a bird trapped in your chest. Now let's dive a little deeper. When your heart beats faster than normal, it's called tachycardia. Picture yourself running a marathon. Your heart rate increases to keep up with your body's demand for oxygen. In tachycardia, your heart feels like it's running a marathon, even when you're just sitting still. It can cause a range of symptoms, from palpitations and chest pain, to dizziness and fainting. If it happens too often or lasts too long, it might warrant a visit to the doctor. On the flip side, there's bradycardia, when your heart beats slower than normal. It's as if your heart is taking a leisurely stroll when it should be power walking. Symptoms can include fainting, dizziness, weakness, and shortness of breath. Bradycardia is usually a sign that the heart's electrical system is having some issues and may require medical intervention. It's important to remember that these palpitations can sometimes happen for no apparent reason, or they can be triggered by certain factors. Stress, caffeine, and dehydration are just a few examples of triggers that can cause your heart to start doing the jitterbug. But don't let this scare you. Most of the time, these palpitations are harmless, a simple reminder that our hearts, like us, can have off days too. However, if they are accompanied by severe symptoms, it's crucial to seek immediate medical help. Now that we know what heart palpitations are, what should we do when we experience them? Let's explore that in the next part of our discussion. Experiencing heart palpitations can be alarming, but there are steps you can take to manage them. Let's start with lifestyle changes. These adjustments to your daily habits can play a significant role in preventing heart palpitations. Firstly, consider reducing stress. Our hearts often mirror our emotions. When we're stressed or anxious, our hearts can race, skip, or flutter. So, finding healthy ways to cope with stress, such as yoga, meditation, or even just a simple walk in the park, can help keep your heart calm and steady. Next, it's time to bid farewell to that morning cup of joe. Yes, you heard right. Caffeine can be a trigger for heart palpitations. So try to limit your intake, or consider switching to decaf. It might be a tough adjustment at first, but your heart will thank you for it. Also, remember to stay hydrated. Dehydration can lead to an imbalance in electrolytes, which are crucial for heart function. So, keep a water bottle handy and sip away throughout the day. But here's the thing, while these lifestyle changes can be beneficial, they're not a cure-all. If your heart palpitations occur frequently, last too long, or come with severe symptoms like chest pain, dizziness, or fainting, it's time to call in the professionals. Don't hesitate to seek medical help. Your heart is too important to take risks with. In some cases, palpitations might be a symptom of a more serious condition such as tachycardia, where the heart beats faster than normal, or bradycardia, where it beats slower. These conditions require medical intervention and may involve medications or the use of a pacemaker. So, remember, while lifestyle changes can be a great first step in managing heart palpitations, they're not the only answer. If in doubt, always consult a healthcare professional. After all, it's better to be safe than sorry when it comes to your heart. But what if lifestyle changes aren't enough? Sometimes medical intervention may be necessary to manage heart palpitations. When our hearts beat too fast, a condition known as tachycardia, or too slow, referred to as bradycardia, these irregular rhythms can become more than just an occasional inconvenience. Tachycardia can trigger not only palpitations, but also chest pain, dizziness, and even fainting. If these episodes occur frequently or last for an extended duration, it might be time to seek medical treatment. In some cases, medications could be prescribed to help regulate your heartbeat and prevent these symptoms. On the other hand, bradycardia can lead to symptoms such as fainting, dizziness, weakness, and shortness of breath. This condition is typically caused by a problem with the heart's electrical system, and medical intervention may be required to address it. One common solution is the use of a pacemaker, a small device implanted in the chest to help control abnormal heart rhythms. It's important to remember that these treatments are not one size fits all. What works best will depend on a variety of factors, including the underlying cause of your palpitations, your overall health, and your personal medical history. So, if you find yourself experiencing frequent or severe heart palpitations, don't try to self-diagnose or self-treat. Reach out to a healthcare professional. They can provide you with a thorough evaluation, an accurate diagnosis, and a comprehensive treatment plan tailored to your unique needs. Remember, it's always best to consult with a healthcare professional if you're experiencing frequent or severe heart palpitations. To recap, heart palpitations can be a sign that your heart is beating too fast, too slow, or irregularly. These sensations, akin to throbbing, pounding, or fluttering, may occur without any apparent reason or be prompted by specific factors. Managing them often involves lifestyle modifications such as stress reduction, caffeine avoidance, and proper hydration. However, should you experience severe symptoms like chest pain, dizziness, or breathlessness, it's vital to seek immediate medical attention. Remember, while heart palpitations can be alarming, they are often manageable with lifestyle changes and medical intervention.